was exactly 5 minutes. I don't know how you timed it, but it was exactly 5 minutes.
Since the 3 panel members hearing this case are also, I think also all members, full members of the Medical Examining Board, with the exception, am I correct? Yes.
No, excuse me, we're not correct.
I'm sorry.
I thought it might be 1 hearing officer, statutory hearing officer. But all of the panel members are aware of the fact that Dr. Jones is the subject of a vendetta by the Department of Public Health that began with a decision that came down in 2007, which is under appeal to Superior Court.
Excuse me, can we stick to this case?
Yes. Well, I would like to, but I think what Mr. Tillis revealed unintentionally is that the department is just not happy with the fact that Dr. Jones has an active Lyme practice, and that, like a lot of other specialists, a lot of people are referred to him by other physicians or self-refer when they go through the medical chain and don't get any attention and any results for diagnosis and treatment of what can be, and in many cases, is Lyme disease. That's not a violation of any statute or rule of practice in Connecticut. Most cardiologists treat cardiology patients who need treatment. Most orthopedists treat orthopedic patients who need treatment. Mr. Tillis didn't talk about the patients who come and are sent away without diagnosis of Lyme disease. Well, sure, most of the patients there are treated for Lyme disease. No big surprise. The non-specific symptoms issue has been already dealt with. The court has decided that Dr. Jones is practicing medicine and can practice medicine without being subject to this DPH declared standard about requiring specific symptoms in order to diagnose Lyme disease. This prosecution, and that's what it is, reminds me of the Indianapolis 500, the driver who makes 500 loops around or 250 perhaps, around the oval, and wins the race. And then after the race is criticized for maybe cutting off a driver, or maybe driving too fast or too slow, or missing a turn or something else. This prosecution is brought without 1 patient complaint, without 1 malpractice action, without 1 person claiming that Dr. Jones didn't treat them properly, neglected them, failed to address their concerns properly, professionally, and constructively. This is a very unusual circumstance in which it's the 2nd case in which the department is asking you to sit as some sort of uber judges about how this man practices medicine in the absence of anybody else complaining. Is the patient population that Dr. Jones serves so ignorant and so incapable of judging him that not 1 person shows up to say that he did something wrong, that he missed something, that he didn't treat them properly, that he failed to do anything? Not 1. So now the department wants you again, a different panel, with 1 person who was on the last panel, to now say, in the absence of all of that, we are going to be some super judge about how you practice medicine, Dr. Jones. Outrageous. And I realize I'm limited to 5 minutes, so I'll stop by just pointing out, just in count 1.
You have 2 more minutes.
I have 2 more minutes. Well, then I'll run with the ball. Thank you, Doctor. To cite a man in a complaint based on what he deemed to be reliable information history from the patient's grandmother, and having the temerity to order a test which Dr. Zemmel said was expensive. That was really why Dr. Zemmel objected, spending too much money. And I agree that the cost of our health care in America is a concern. But that's not a violation of the standard of care when you believe that a grandmother who knows her grandchildren very well describes symptoms. You make an appointment several weeks hence, and you order a test, so you'll have that test when the patients come in. Is that a violation of the standard of care? It would be nice if all physicians could do that. Just to show you the length to which this department is going to cite alleged bogus violations of the standard of care. With regard to the urine PCR test, it appears there are 2 different points of view about the diagnostic value of that test. It's performed by, he doesn't get it from someplace in Lower Slobovia. He sends it to a lab that is licensed, has a CLIA license, has got an FDA-approved test, And that test is being run, not just for Dr. Jones, but for a lot of other physicians. Is that a basis for taking any action against him whatsoever? Another highlight. The alleged school violations took place, school absences took place during a vacation period. You haven't heard any contradiction from our contention about that. Yet the department should have the good graces to withdraw that charge as being factually inaccurate. 2 days this child was out of school. Not a school official came here to say Dr. Jones misrepresented anything to them. It just shows you, again, the lengths to which this department, and I don't challenge Mr. Tillis's professional integrity because he's got a client to represent, but it just shows you the length to which this department is going in the absence of a complaint, in the absence of a malpractice action, in the absence of a parent, a child, anyone who is concerned about his care. Now, I'll agree that as patients, we are not as able to judge our physicians' capabilities as professionals are. And I'll agree that there are many times when physicians and the patients think they are getting good care and they're not. But not one, not a peep, not a complaint, not nothing. This is horrendous. This is outrageous. We'll cover that in greater detail in our submissions.